Maji, nikiachana na taarifa hiyo inayofungamana na masuala ya elimu, moja kwa moja katika taarifa inayofungamana na masuala ya afya, ambapo baraza la magavana sasa linaikosoa serikali ya kitaifa kuhusu msukumo wake wa kuwasafirisha wauguzi waliofuzu nchi za nje, likisisitiza kuwa sera hiyo lazima ibatilishwe na kufikiriwa upya. Mwenyekiti wa kamati ya afya ambaye pia ni gavana wa kaunti ya Tharaka Nithi, Muthoni Njuki, amebainisha mojawapo ya suluhu za kuboresha sekta ya afya nchini ni kuwekeza zaidi katika wafanyikazi wenye ujuzi na pia kuzuia ufadhili wa huduma za afya kupitia sheria ya hazina ya uboreshaji wa vituo. Kwa mengi zaidi, hii hapa ni taarifa yenyewe.
The development of training programs for community health care workers could not have come at a better time in Kenya than now, when the country has just enacted 4 acts of parliament to achieve universal health coverage. These acts have introduced fundamental changes in the delivery of health services in Kenya, placing primary health care and community health promoters at the center of health delivery services. The devolution era has yielded significant results in this regard, increasing access for mothers and reducing morbidity and mobility for both the mother and the baby. With 89% of mothers currently delivering under skilled care in Kenya, as compared to 66% before devolution, that is before 2010. There has been a rapid decline in maternal and child mortality rates, and I would say that between 2014 and 2022, Kenya's under 5 mortality rate reduced from 52 deaths per 1,000 births to 41 deaths per 1,000 births, and the infant mortality rate from 39 to 32 during the same period per 1,000. For a doctor to stay in Wajir, they need to be remunerated in a way that it gives them motivation to stay there, while a doctor may not need any motivation to work in Ruiru and Thika and on Ngong Road in Nairobi. The difficulty with recruitment and retention is a big problem, because internal and external migration of health workers is at all-time high. The healthcare workers has a big shortage. Currently, the Kenyan public sector has a health worker crisis with only 14 health workers per 10,000 Kenyans. That ratio is something that I think is not duplicated in Western countries, but I believe it's a common scene in almost all of Africa. 14 to 10,000. So even when we talk about exporting health workers, it is a paradox, because we are giving away the cream de la cream, while our people are being treated either by low cadre, I don't want to say quacks, but it is definitely a crisis, because we are supposed to be retaining the best while we export the surplus. Specialization, the specialized health workers like the postgraduate doctors, we have a big shortage in Africa. And that is why today in the Kenyan scenario, and I say this in public, we have, for example, have only 60 oncologists in Kenya, with a population of almost 60 million. Why is it that we cannot emphasize on having those specialists in Kenya as much as we are focusing on the lower cadre? I have been looking for a radiologist for Tharaka Nithi for the last 3 months without any success.